Hey everybody, it's Lisa from Lisa Bug Fitness and Yoga, and I have not posted for a little bit on a knee replacement update. I am at 46 days post-op. I think my last one was at 37, and I'm seeing a little bit of incremental improvement, and it is so exciting for me. In my previous videos, I've kind of been focused on my pain level, excruciating, horrible, terrible, all of that, and now I can say my pain level is what I would call manageable. Is it still there? Yes. Is it worse at other times? Yes. Do I still have swelling and inflammation? Yes, but the pain is more manageable. And I'm able to manage that just with ibuprofen and Tylenol, which is really good. But I'm trying to find a balance with that because the ibuprofen's been kind of bothering my stomach a little bit. But I'm getting better with that pain level, which is amazing. Getting a little bit better with strength. My quad has really kind of shut off, and I can't go upstairs yet, but I'm getting a little bit more strength in that. I practice over here on this little 4-inch step bench that's by my bike, and I have to use my bike for a little bit of balance to step up on that 4-inch bench. A regular stair at home is maybe 8 inches, but I'm working at it, and I'll get there, I'll get my strength back. But what I'm excited about is I've been able to move my flexion a little bit better. I was kind of stuck. I couldn't go around on the bike. My flexion was in the 90s, kind of went to 100, but I was able to push my active flexion this past week, which means the amount you do by bending your knee by yourself, laying on your back. I was able to improve that from 90 to 100 in 1 week. And I think that was because my hamstring's firing a little bit better, because you have to flex the back of your leg to bend your knee up. So I think that strength is helping me with my active flexion. My passive flexion, which is the amount that I can either use a strap or a machine to help me, has gone up to about 116. So I'm really happy with that. I think that the doctor wants you to get a minimum of 120, but I would like to see more like 130, 135 if I can push a little bit further. So I'm going to be working on it constantly for weeks and months ahead to get more flexion. But it's given me enough bending my knee to go around on a bike, which is really a big improvement. So I'm able to go around on my road bike here. I have to hike my hip up a little bit yet, but I can go around on the recumbent in physical therapy. So all of that is fantastic. So little improvements add to big ones in the end. And I'm really feeling better about where I am today at 46 days post-op. I joined this I joined this Facebook group called Succeed with Your New Knee. And there's thousands of people on this Facebook page, and they post everything going on with their knee replacement. And what I realized is there's no normal for recovering from this. Everybody's different. I see people that are at 6 to 7 weeks where I am, and they're way ahead, and they're already walking 2 miles, which I'm not, and they're bending their knee to 130, which I'm not. But I try not to focus on comparing myself, because there's a lot of people out there that are at 12 weeks, 15 weeks, and can't even bend past 80 or 90 degrees, and they're having to go into the hospital and have manipulations done where they put them under anesthesia and they bend their knee, and then they have to keep working on it. So I have to be really thankful for where I am. And I'm thankful for all of my Lisa Bug people, my friends and family, for always being so positive for me and concerned and keeping in touch. I appreciate that so much. It's helping me get through this journey. And I have to also remind myself that Dr. Mayer told me the first 2 weeks were going to be really bad. Or 2 months, sorry, are going to be really bad. I'm not through that yet, but I'm getting close. And that it takes a full year to really recover from knee replacement surgery. What I'm also positive is that I have had full extension of my knee, so I'm able to completely straighten it, and I have from day one, and that can be really a challenge for folks. A lot of people, their knee is a little bit bent, which makes it hard to walk correctly, and for their quad to fire. So I'm really, really happy that I've never had any trouble with my extension. So it's just that flexion, and I'm getting there a little bit at a time. I'm working at it on the reformer. I'm using that TENS unit. I also bought a new little tool, one of these massage guns. So what I do is I get my knee up to, say, a maximum bend, and I turn it on, and I just massage this quadricep muscle because a lot of the problem with bending my knee is in the tightness of the quad. That was the tissue in the quad, hamstring, and adductors here were so traumatized by that tourniquet, so I can barely touch it. It's really, really sore on the lowest setting, but I think that's giving me some help in getting those tissues, just the fascia loosened up, the muscles, and to be able to get more flexion in the knee. Also, just the last day or two, I think I've lost all the scabs on my knee, and the incision looks to be fully healed. So I should be able to start submerging that now if my doctor says it's okay at my 8-week post-op appointment, so I can get in the pool and do some pool exercises, or even in the hot tub and bend that back and forth. I think that would feel great. So anyway, that's my update. Thanks for following along, everybody, and I'll see you next time. Take care.